Alberta now has the highest number of measles cases per capita in North America. That's according to the province's former top doctor. Alberta has reported more than 1,200 infections since March, and there are concerns about large crowds at the Calgary Stampede, which is underway now. So for more on all of this, we've reached Dr. Lynora Saxinger in Edmonton. She's an infectious diseases specialist at the University of Alberta. Hello, welcome. Thanks for joining us.
My pleasure, I guess.
Okay, well, we heard that Alberta has the highest number of measles cases per capita in North America. I mean, how do you react to that? Why is this province the hardest hit right now?
Well, I mean, this is just an appalling situation. This is not something that I expected to see in my lifetime as an infection doctor, because measles has had eradication status in Canada for many years. And the scale of this outbreak is really massive. Alberta, like many places, is not a single population. There's many populations within a population. And I think that what we're seeing is very under-vaccinated populations are having very high rates of disease, and it's basically network spread. And so it's very hard to contain that. And that's what happened in Ontario as well, I think.
When you're talking about that, of course, in part is the fact that it is such a contagious disease. And so that can also lead to several complications too. So how concerning is that spike and the spread?
Well, we haven't really seen it leveling off. We're seeing continued spread. We're seeing more involvement in the larger cities, Edmonton, Calgary, which have very high vaccination rates. And we know, as you said, that if measles is around and you're vulnerable, there's a 90% attack rate. And so any given exposure can result in many secondary infections. Most people think of measles as a rash illness, but really it's a whole body illness that can have serious consequences for a small number of people, especially kids under 5. And when you multiply a small, incidence of severe outcomes across a very large group of vulnerable people, you do start to see high hospitalization rates and really bad and lifelong effects of measles in, babies and young children especially. And in our adults, we're actually seeing quite a high hospitalization rate as well. It's a severe illness on its own.
Dr. Saxinger, of course, across this country, there's no secret that there have been challenges with healthcare, with resources being stretched. So when you look at something like this, a measles outbreak, and of course, it's quite a learning curve for physicians, because to your point, this isn't something that people would have necessarily been trained on because measles had been eradicated. How have all of these factors sort of come together in terms of the impact on the healthcare system in the province?
The absolute numbers of people hospitalized at any given time is fairly low, but the fallout for the health system is a lot of diversion of resources. You need to have very strict isolation precautions and infection prevention and control investigations to track people who've been exposed and quarantine them. And so there's a tremendous amount of work associated even with the small measles outbreak. And right now there's a lot of restructuring and role clarity issues, and it really is a huge burden already, in addition to people being ill. And we also suspect there's probably more cases uncounted, and I would expect we will start to see more people coming to hospital with measles.
We were talking about the impact of the Calgary Stampede, for example. Do you anticipate that will, perhaps show another spike then, as we'll see what happens, I guess, in the next few weeks?
I think there's a real risk of that because, you think open air should be lesser risk, but measles is very, very transmissible. And there are lots of places where people will be in very close proximity. And it's a mingling of people from different areas, including some very under-vaccinated areas. And so I do expect there will be fallout. And, that does make it harder to control because it becomes impossible to trace after a period of time. And so that's why we have whole zones in our province are basically considered measles exposure risk. And they're not really trying to do specific tracing anymore of people exposed in public places. And so that's a pretty bad sign.
We briefly touched on how severe the complications can be. I'm wondering if you can talk to our viewers a little bit more about what can potentially happen when you do contract measles, who's most at risk, and what symptoms people should look out for.
Right. So, measles starting with what it looks like. It starts with a cold-like illness, but one specific feature might be eye irritation or conjunctivitis, and then, runny nose. fever, feeling unwell. And then after, maybe 3-4 days of that, the rash starts. The rash usually starts on the head and neck, behind the ears, and travels down the body. And that is usually when it becomes more clear what's going on and that this is in fact measles. The problem is, of course, you're transmissible before the rash appears. And so people might be unknowingly exposing others while they have the virus going through their body, but it has not yet caused a rash. And, adults can get pretty bad lung infections with measles, so pneumonitis and hepatitis. For kids, the feared complications really are they're very prone to infections, both in the short term, like ear infections and pneumonia, and then in the longer term, because it does cause a loss of immune memory. And so they're more prone to other infections for a very sustained time. And then measles itself can cause encephalitis or inflammation of the brain. And that is a very bad outcome with potentially like lifelong consequences in terms of brain function and sight and hearing. And then there's a very late complication of measles, SSPE, or subacute sclerosing panencephalitis, which appears, many years after the initial measles and is an absolutely devastating, debilitating and fatal neurologic disease. And so those things all, as I said, occur in 1 in 1,000 or less for the death or for encephalitis. But when you multiply 1 in 1,000 across, there's probably 5 or 6 million kids under the age of 14 in Canada, and a good proportion of those might be susceptible to measles. That's a big burden of a preventable disease.
Well, thank you so much for that very valuable information. Hopefully people find that helpful. That was Dr. Lynora Saxinger. She's an infectious diseases specialist at the University of Alberta. Thanks for joining us.
Thank you.